Good morning, everybody. Thanks for coming down to our Tacoma office. We have the AG's office has 13 offices around the state, so it's great to be here in our Tacoma office. And before we get started, I want to introduce a few folks who I'm joined by today. To my left is someone many of you will recognize. That's one of our state representatives, Lori Jenkins, who represents our office right here in Tacoma. So she's a legislator we do an awful lot of work with. And she's here today, and I'll speak a bit more about that later on, because she's especially involved on the issues that pertain to this lawsuit and this Consumer Protection Act, and she's been a real leader on these issues. So you'll be hearing from Representative Jenkins shortly. To my right are two members of my consumer protection teams. These are Assistant Attorneys General in the AG's office. Audrey Udishin is to my immediate right, and Bob Hyde is further to my right. And they will be helping to answer questions that you may have about this litigation, but they've been working hard in this case for many months at this point. Washington State's charity laws are meant to ensure that all hospitals in our state provide access to free or reduced cost medical care to low-income patients who need it. It's obviously a very important set of laws. Today, I filed a lawsuit in Pierce County Superior Court against St. Joseph Medical Center here in Tacoma, alleging the hospital repeatedly violated Washington State's Consumer Protection Act by withholding charity care from tens of thousands of low-income patients since at least 2012. St. Joseph's, as many of you know, is the flagship facility of CHI Franciscan, a large Washington-based healthcare system. To be clear, this lawsuit is specifically related to the conduct at St. Joseph. Moreover, senior managers within St. Joseph knew about complaints associated with these illegal practices, knew they were a problem, and did not correct them. St. Joseph was founded by the Sisters of St. Francis, who, and I'm quoting now from St. Joseph's website, ministered to all people, regardless of race, religion, or financial status. The hospital's vision, I'm quoting again, is to lead the transformation of healthcare to achieve optimal health and well-being for the individuals and communities we serve, especially those who are poor and vulnerable. Our investigation, however, uncovered that St. Joseph is not living up to that vision. In fact, it was doing exactly the opposite. St. Joseph placed obstacles in the way of thousands of individuals in need of affordable health care. These are individuals who, moreover, had to make hard choices, paying money they should not have had to pay for health care rather than paying the rent or feeding their children. These laws exist for a reason, to help ensure that everyone has access to affordable medical care. St. Joseph's conduct is illegal, and it harms vulnerable Washingtonians. So today I'm going to briefly provide an overview of our charity care laws. Second, I'll describe how St. Joseph violated those laws. Third, we'll present just some of the evidence that my team uncovered through its lengthy investigation of St. Francis. And fourth, we'll explain what we're hoping to accomplish with this lawsuit, and afterwards we're happy to take any questions that you might have. I'll start with questions for those here in the room. I think we have folks on the line. We'll turn to some questions for those on the phone, then come back to a couple final questions here as well. So briefly, an overview of our law. All hospitals in Washington State, whether you're for-profit or nonprofit, public or private, are required by Washington State law to provide charity care to individuals who are at or below 200% of the federal poverty level. The law requires hospitals to meaningfully provide patients information about the availability of charity care. In violation of the law, St. Joseph repeatedly failed to provide that notice. I'll give you an example. St. Joseph made no effort to screen for charity care with their patients. Instead, they aggressively trained their staff to seek payment before providing charity care information, thereby deceiving patients and violating the law. The law also prohibits hospitals from requiring more than one document to prove a patient's eligibility for charity care. St. Joseph unlawfully required multiple forms of documentation. I want to be clear about this. This is not some procedural requirement. This requirement of multiple documents placed a significant obstacle to vulnerable patients seeking access to affordable care and resulted in denials of 50% of their applicants. I spent a year directing emergency services office through the Jesuit Volunteer Corps. You only need to spend 1 hour leading a social service agency to understand if you require multiple forms of documentation or ID, you will be turning away many, many folks who walk in your door. This isn't complicated. This is not a procedural requirement. Once you do that, you will have the exact impact and effect that St. Joseph's experienced. They turned away half the folks because of that requirement. During our investigation, we uncovered evidence that St. Joseph's on-site vendor, supervised by St. Joseph, systematically trained employees to violate the law. We also uncovered evidence that St. Joseph's senior management became aware of these concerns and failed to address most of them. As I mentioned earlier, employees were trained to demand payment upfront before providing information about charity care. I'll just give you a couple examples. Now, that payment could be $250 or more upfront for uninsured patients. Training materials instructed staff, and I'm quoting now from the training materials, quote, avoid phrases that give patients the option to not pay. One former employee reported they were told to, and I'm quoting now from the former employee, they were told to, quote, never volunteer information about St. Joseph's charity care program to patients, even if they were obviously low income or homeless. That former employee also reported that they were instructed to, and I'm quoting again from that former employee, to encourage patients to pay the deposit by indicating that I could only provide them with a charity care application if they paid a deposit first. In a document also obtained in our investigation, one executive wrote to colleagues, quote, I'm afraid this is going to backfire on us if we are not very careful very soon. Despite senior management being aware of these problems, St. Joseph did not take steps to fix many of the problems until after my office started investigating in January of 2016. These illegal practices resulted in significant harm to the community. Between 2012 and 2015, St. Joseph consistently provided charity care at much lower rates than the regional average. And I believe we have a chart to my left that illustrates this. Sometimes as much as 40% lower. If St. Joseph had provided charity care at the regional average, it would have given $70 million more to help its neediest patients pay their medical bills. For St. Joseph's illegal conduct, I'm asking the court to provide restitution for low-income patients harmed by the hospital's practices. In addition, I'm seeking civil penalties for tens of thousands of violations of the state's Washington State's consumer protection law. Each violation under state law can have a penalty of up to $2,000. So just to be clear, we're alleging thousands of violations of our Consumer Protection Act. Each individual violation of the Consumer Protection Act, a judge can impose a penalty of up to $2,000. The state's charity care laws exist so Washington's most vulnerable patients have access to affordable care. Our office will work hard to ensure that all patients have access to affordable care by enforcing these very important laws. Next time, we're going to hear from Representative Jenkins. As I mentioned before, she's been a real leader on these issues in the state legislature. We greatly appreciate her being here, taking time from her busy schedule to join us, and just appreciate her tremendous leadership. She's a great partner in Olympia, but especially on these extremely important issues. So Representative Jenkins, go right ahead.
Thanks, Attorney General Ferguson. And I quite strongly wish I weren't here today, and wish I hadn't had to spend much of my legislative career filing charity care bill after charity care bill after charity care bill in the state legislature. As folks probably know, nearly all the hospitals in Washington State are actually nonprofits. They're required to provide charity care. They are charitable organizations. And I would just say that my personal experience related to this, I did not know the AG's office was working on a lawsuit, but I've spent much time over the last 4 years in meetings just a half a mile away up at Shiloh Baptist Church, hearing from patients of St. Joseph's Hospital, talking about charity care, talking about how the hospital has aggressively tried to seek payment from them when they have no money. I've heard from the story that AG Ferguson told, I've heard from that staff person directly, where she was sent to collections while her charity care application was supposedly being reviewed, and heard really from dozens and dozens of people in the community. What we really need in Washington is our charitable hospitals to stand up, for St. Joseph's to stand up, to provide the charity care that they are required to by law, and that they honestly should be morally obligated to because they're a charitable organization. So I just really want to thank the AG's office for the work that they've done on this, and I'm very pleased to work in partnership with you, and we'll do things in the legislature to try and address these and other issues that have been raised over the interim.
Thank you. So just a final thought before we take your questions. Thank you, Representative Jenkins, for your hard work, and look forward to working with you in Olympia on the legislative side as well. I mentioned at the beginning that St. Joseph's was created by a group of sisters, and their stated purpose in creating the hospital was to provide access to health care for the poor. I want to be clear. St. Joseph's has lost their way from that original vision. That's a hard thing to say. I take no pleasure in saying it in the same way you take no pleasure in being here. But it's the truth, and it's not right. They're going to be held accountable, and they will absolutely correct their practices. I will accept nothing less than that. They need to make changes, systemic changes, and they're going to do it. It's unfortunate it comes to litigation to make that happen, but sometimes that's what it takes to get someone's attention.